and welcome to season 2 of Getting to Know ACS with Tracy
and Jasmine.
And today we have a very special guest with us, Jasmine.
Featuring William Beaumont.
Yes. So today we have Colonel Venable, who is the commanding general.
Oh, you promoted me.
I did. Well, you're the commander of William Beaumont Army Medical Center. So we are so pleased to have you. I'm sure you didn't mind the promotion, though. Yeah.
It's awesome to be here. Thank you so much for having me.
Well, thank you for being with us on our kickoff of season 2. So, Colonel Venable, we just wanted to bring you on because we have a new facility that hasn't been quite a year yet.
Not even a year. We opened the doors in July.
Okay, wow. So we're going to be talking about William Beaumont Army Medical Center, the new one that took forever to open, even though that's not your fault. Let's put that out there. So just tell us, to start off with, can you tell us what people can expect coming to the new facility versus what was going on at, I don't know, what do we call the old one?
The Legacy.
The Legacy, yes.
So the new William Beaumont, it is a gorgeous facility. 135 beds. We're a level 3 trauma center. We have 30 specialty services. Just a magnificent facility. 10 beautiful state-of-the-art operating rooms.
Okay.
So you can expect a great patient experience coming to the new William Beaumont.
Okay, that's awesome.
So with the new one, though, because obviously we had the Legacy and now we have the new one and it's still semi-new. What is the vision? Like, where are we going with that?
Right. So we're trying to make William Beaumont the premier readiness platform.
Okay.
So trying to, bring all the surgeries. During COVID, we had a lot of, partnerships, and we still do. We continue to do surgeries and things downtown, but we really want to optimize the resources that we have, optimize those operating rooms, and make it a readiness platform because it's really 2 functions. The first is we want to take care of all the soldiers and beneficiaries that work and live here in the community, but it's also about making sure that our medical professionals, our surgeons, the support staff, that they have the skill sets that they need to deploy and perform their wartime mission.
Okay. So what is your vision, moving forward? What are some of the things that people can look forward to at William Beaumont that may have not been in place previously?
So I'm really focused on 5 priorities. The first, as I mentioned before, is about medical readiness.
Right.
Making sure that our soldiers are ready to go, making sure that our professionals are medically ready. It's also about patient safety, making sure that we're providing, no harm to the patient, that we're providing high quality healthcare and patient-centered care. I'm also focused on optimizing resources. So on 1 October, we actually stood up the El Paso market. So we're under the Defense Health Agency. And one of the reasons they stood up DHA was to ensure that we're providing the most cost-effective services that we can. So I'm really focusing on optimizing resources, make sure that we are being good stewards of the taxpayer dollars, because at the end of the day, resources are limited and we have to do our part. I'm also focused on the patient experience, patient satisfaction. That's why we exist, is to take care of the patient. So I want to make sure that we're providing the best patient experience possible for our beneficiaries. And then the last and equally important is staff satisfaction.
Okay.
Yeah. We want to make William Beaumont a great place to work, a place where people can come and achieve their full potential. And so I'm really committed to making sure that we're taking care of our staff, giving them the opportunities they need to grow so that they'll continue to work and live here in the El Paso community.
Okay. And we're going to revisit that too, talking about the staff, and we'll come back to that in a little bit. But one of the things, I know you were talking about patient satisfaction, that type of thing. So how do we go about accessing care? For, if I'm a patient, how would I utilize access and care to the facility?
Sure. So to access care at William Beaumont, there's really 5 ways you can do that. The first is to call the appointment line, which is 742-CARE.
Oh, easy.
Oh, yeah.
It's easy. Call in and book your appointment through the call center. You can also go online, TRICARE online, to book your appointment. And starting back in November, we actually put over 95% of our appointments for families on TRICARE online. So very easy. If you don't feel like making the phone call, you can just go online, book your appointment on TOL.
Oh, okay.
The third way, and this is an underutilized resource, is the nurse advice line. So if the clinic is closed and you need to get an appointment, or you just have a question about, hey, should I take my child to the emergency room? I'm really not sure what to do. You can call 1-800-TRICARE and talk to a registered nurse 24/7. And the great thing about TRICARE Online is the registered nurse they have access to our system, so they can actually book you an appointment.
Oh, okay. So I could, like my child is running a fever.
Right.
And I can call that line and tell the nurse what the symptoms are. And then if she warrants that, okay, you need to take your child in, she can actually go ahead and make the appointment for you at that moment.
She can.
So you don't have to worry about, okay, now I got to hang up with you and call TRICARE.
And a lot of times it may not even warrant a visit. People just get concerned.
Right.
And so now you get to talk to a healthcare professional and they can give you guidance on what you should do. And sometimes that's just home care. Okay,
I like that. That's a good one. Yeah. So I know previously when we spoke with you, one of the things that you spoke about was the pharmacy. Mm-hmm. So, because, we get a lot of questions, or we don't get questions personally, but we see questions on Facebook. It's like, oh, I had to wait for so long at the pharmacy. So I know you had some innovations that you were talking about for the pharmacy to kind of help that experience be a little more pleasurable.
Right. So when I got here last summer, I know one of the biggest ICE complaints and on our Joe scores were, complaints about the pharmacy, the long wait times.
Right.
So back in September, I actually went to the Defense Health Agency and I asked for their help. I said, hey, we're having some challenges here. Can I get an expert to come down and actually, kind of map out our processes and look, how can we improve and optimize the resources that we have in the pharmacy? So they came down in September and made a bunch of recommendations. And we actually got those implemented late October timeframe. And so I think you can see now there's tremendous improvement on the wait times and all of our locations. One of the other things we're doing too is we're getting script centers.
Okay.
So script centers are automated locker systems, and if you've visited other MTFs and other locations, you may have seen these before, but they're these big automated lockers. And the cool thing about those is, like, if you have to pick up a refill 24/7, it's at your convenience. You can stop by the script center, swipe your ID, and open up your little locker and pull out your refill, and then you're on your way.
That's nice.
So basically, no line.
No line.
I mean, unless somebody's in front of you.
No desk. You can avoid the desk then too, right?
So you just go straight up. That's awesome.
That'd be cool.
I like that.
At your convenience.
Yeah. And so you said that's now operational now?
So we're working with the Defense Health Agency to procure those. Uh-huh. We'd ideally like to get 3 of the script centers.
Okay.
We are hopefully getting one in March.
Okay, so pretty quick here.
So pretty quick. So just working with the Defense Health Agency to get those on ground, and I think that's going to be just a huge win for everybody in the pharmacy.
I think you'll find that hopefully, because people, I just want to put this out there, you can use ICE comments for kudos and job well done. So hopefully you guys get those, and then you get those good ICE comments as well, because we like to focus on those bad ones, for whatever reason.
Before I forget, I did want to remind everyone, as we were talking about ways to access care.
Oh, yes.
I also want to remind everyone that so the other couple ways that you can access care is secure messaging system.
Okay, and how does that work?
So that's through Relay Health. And so you can actually go on TRICARE Online and register for it. Mm-hmm. And what that allows you to do is you can secure message your primary care team.
Okay.
So if you have questions about maybe it was a prescription that you received, or you weren't really clear on what the doctor told you to do, you just, message the care team and you can start that communication and everything's secure. So I highly recommend that. Okay. And then of course, I always want to remind people that our emergency room's open at 24/7. So if there is an emergency situation, folks can certainly use the William Beaumont emergency room.
Okay. So speaking of the emergency room, another question that we see on the other Facebook pages is where people are like access for their children. Mm-hmm. And they're like, okay, it's after hours. Do I I'll see on there is like, oh, take your child to Providence or take your child to this medical center, because they're like, there's no pediatrician at Beaumont's emergency room. So do you want to clear up on that, what the procedures are if you have an emergency and you have a child? How would that
certainly
work?
if there's an emergency, you want to go to the nearest emergency room.
Okay.
So in El Paso, they have the El Paso Children's Hospital. They have a pediatric ER.
Okay.
That folks can certainly take their child to. And then, of course, William Beaumont, we are open 24/7 for emergencies. And if we do need to transfer a child, for example, to El Paso Children's Center, then, of course, we can do that.
Okay. And so another way, I think you mentioned prior to us being on the urgent care.
Sure.
So they can also utilize urgent care facilities as well.
That is correct. So that's for family members. So a family member, certainly you do not have to get a referral as long as the urgent care accepts TRICARE. You can go to urgent care as an option as well.
Okay. So and that's not just for pediatrics, but that's for all family members that have that benefit.
Correct.
So as long as TRICARE accepts it, then they can go there. So if I can't get an appointment, say for whatever reason, at Beaumont, then I can go to an urgent care that's in my neighborhood, because they're everywhere. They're in all the neighborhoods. Yes. So so that's great. Yeah. So I know.
I have a question real quick, just because I know for me, driving to new places kind of stresses me out. William Beaumont is massive. Okay, like it is huge. So the parking situation.
Sure.
If there is an emergency, I know we had spoken before that you can like drive up and drop off, correct?
Correct.
In an emergency. So you don't have to park way in the back.
Right. If it's an emergency, we want you to drive up and, I certainly drop the patient off to get them to care as quickly as possible.
Okay. I just wanted to clarify that because I feel like people are just like, I'm not going to park all the way back there. And
then my emergency, there'll be an emergency in the parking lot.
Right. And eventually there will be shuttles. Is that correct? Or am I lying?
Right. So right now, for example, let's say that you pull up into the park line, you need assistance getting into the hospital itself. They have those blue call stations.
Yes.
You can pick those up. It'll take you to security. Just say, hey, I need some assistance. And we'll actually send somebody out there to help bring the patient into the facility.
Yeah. I like that.
It's wonderful.
Yes, I remember that last time, but they look like little bus stops.
Yeah.
That's what they remind me of. That's why I was like, is there a bus?
And I know people think it's so difficult to get to the hospital, but actually when you get off on the exit and it's pointing you there, you get there it's really simple.
So I get lost everywhere, and it was actually not that bad for me to find. And it's a massive building. You just follow the building.
Right.
Yeah, just head towards the building.
And once you enter the facility, they actually have kiosks there with masks, and you can tap around and figure out where you need to go. And of course, we have we have volunteers that are there that can assist patients at any time as well.
Right. I like that. That's okay. So I can see great things. So I know this would not be a complete podcast if we didn't touch upon COVID a little bit.
Okay.
Because that's the day and age we're living in. So how are you guys dealing with COVID, with testing and with vaccinating people and all that good stuff?
So I'll start off with testing.
Okay.
So there's actually 2 testing locations on Fort Bliss. We have one, the drive-through on Chaffee Road.
Okay.
And then, of course, we have the one over at William Beaumont that's right adjacent to the emergency room and the H parking lot.
Okay, H parking lot.
Correct. So as you all know, after the new year, we had this huge spike in cases, and we had a lot, high demand for testing. And so what we did on the Chaffee Road, we expanded the hours.
Okay.
So it used to be open only until noon. So we expanded the hours from 7:30 to 1600 Monday through Saturday.
Okay.
And then over at William Beaumont, we used to only have 4 parking spaces. So people would come up and, they could call the number. Someone would come out, do the swab, and then, they would be on their way.
Right.
So certainly after holidays,
4 was not enough.
4 was not enough. So we actually took the entire H parking lot.
Oh, okay.
And made that a testing site. And then we expanded the hours. So we're actually open 7 days a week from 10 o'clock to 2000 hours.
Okay. So question with that, do you have to have a referral or can you just go?
That's a great question. So you do not have to have a referral. If you drive to one of those locations, we will get you squared away and get you tested.
Okay. Awesome. And if I'm in line
Sure.
And it's 1600 or whatever time is closed. Am I still going to get to be seen?
You're going to get tested.
It is 1755.
We're going to get you tested. And the nice thing is once the results are available, we'll actually post those on TRICARE Online. So you can log in securely and find the results of your test.
Okay. So it sounds like we're a lot of the information that people are needing, they should download or check out TRICARE Online.
TRICARE Online. You can also go to our website, which is William-Beaumont. .tricare.mil. And then also Facebook. So we're on a daily basis. We're normally posting updates on Facebook. So definitely have like Facebook so that you can get updates as they become available.
Okay. So that's the testing.
That's testing. And then for vaccinations, I think everyone's aware we used to have a vaccination site over at Stout Gym.
Yes.
That has moved to Milam Gym. They're on Cassidy Road.
Right down the street from ACS.
And so that's open from 0900 to 1500 Monday through Friday.
Okay, and again, no appointment is necessary. They can just go in and get those, or do you need an appointment?
That's correct. So right now, active duty can just show up, get their vaccine. They can also get their booster. But I do have to caution for family members, there was a message that came from the Department of Defense back on 13 January that has put some temporary restrictions on vaccinating family members and civilians. And the reason is because the adult Pfizer vaccine, we call it the purple cap. They are discontinuing that and moving to what's called the gray cap. So there's limited supplies of the purple cap. And so because the military have a mandate to get vaccinated, they're trying to conserve those until we get resupply the other. Family members can certainly get Moderna. We have very limited quantities of that. So we're trying to get more of that on order. So for right now, if you're 5 through 11, for pediatrics, we do have the pediatric Pfizer. You just need to contact Mendoza. Get your appointment there to get your 5 to 11-year-old immunized. And then for 12 and older family members, they can still get vaccinated off post. And there are several websites that you can go to. One is elpasostrong.org. There's another, www.vaccines.gov. So, and we can certainly, we'll post those sites on Facebook. But if you go there, my understanding is you can get next day appointments, for family members to get the vaccine or the booster.
So awesome. Quick clarification on the Milam situation. Is it just the vaccine that's limited or the booster as well?
So it's both.
Both. Okay. Just wanted to clarify that.
Because, so soldiers, active duty period, they can get it, and then just limit it right now for family members until you guys get the gray caps.
Until we get correct.
Look,
sorry, we don't know too much about vaccines. So I'm just like, I don't know if that's the same thing. Sorry.
The gray cap Pfizer or the Moderna, we've also ordered that to take care of our families as well. And civilians.
So I know, and if you don't know this, that's fine.
Sure.
But if they have, like, say, for instance, if you got vaccinated with Pfizer, can you do the Moderna booster, or do they recommend that you do the Pfizer?
That's a great question. So you can intermix. So, for example, my first 2 doses were Moderna, so that was vaccinated, and then I went and got my booster, and it was Pfizer.
So you can mix them.
You can mix them.
So they don't have to worry about, all you all have right now is Pfizer and I was Moderna, so I can go get that. All right. Absolutely. That's good. So Jasmine, do you have some questions before I ask the questions about the jobs?
No.
Okay. So earlier you mentioned about, the job situation with Beaumont. So how can somebody go about working for your wonderful establishment?
That's a great question. So on a weekly basis, we actually post on Facebook. That's why it's important to like William Beaumont on Facebook.
Yeah. Remember that, like their page.
Right. So we post job openings on our Facebook page. And then folks that are interested in applying, you just go to USA Jobs and put your application in. And
go from there.
So
every week you guys will actually on your Facebook page list the jobs that you guys are going to have open, and then they just look at that and say, hey, go to USA Jobs. They're interested in, they can go to USA Jobs. Of course, they can go to the USA Jobs site as well, and all those job listings are posted on there. They post up anyway, so that's good. Do you guys ever do job fairs or anything like that, or is it just like a hiring fair?
So my time, I think with COVID, there hasn't been one since I've been here. But I believe, normally we typically do have job fairs.
Okay. So
but that's a great question.
Medical.
So hopefully as COVID starts to
mellow out there.
Yeah.
we get a chance to do an in-person.
I was going to say, once we get to our new normal again.
Yeah, absolutely.
Okay. So I'm going to give you this opportunity. I've asked my questions. So I want to give you the opportunity to address anything that you would like our listeners to know about. So.
Sure. So one thing is, at William Beaumont, we're striving. I think I mentioned earlier that one of my top 5 priorities is the patient experience, patient satisfaction, and so the only way that we can really improve services is if we get feedback. And I know, people will file ICE complaints. Some, we get positive ones as well. but feedback is a gift.
Yes, it is.
We also get feedback on our Joe's, patient satisfaction surveys. But one of the things that we do at William Beaumont is we actually have a patient and family partnership council.
Okay.
And so our next one is scheduled for next week, not this Wednesday, but the next Wednesday on 9 February at noon. And so it's going to be on Facebook Live.
Okay.
But we highly encourage, all of our beneficiaries, if they have time, to dial in and provide us feedback. What do you have questions about? What concerns do you have? What are we not doing well? Because the only way that we can improve is if we hear, directly from the patient. So I would just put that out for everyone. Hey, we welcome your feedback. If you have time, please dial into this Patient and Family Partnership Council and tell us how we're doing.
So how often do you have that Patient and Family Council? Is it like a monthly thing, weekly? How often is that?
So we try to have that at least once a quarter.
Oh, a quarterly. Okay. So that's good. So to find out about that, again, follow you guys on Facebook.
Follow us on Facebook. Absolutely.
We're going to beat that in everybody. It's like follow them on Facebook. So they can follow you on Facebook. And you all do have a website. Or do you have?
We do. We have a William Beaumont website.
Okay. And now is that information also on the website in case, because we do have some people who are anti-social media.
Sure. Yeah. So we post it on the website. We post it on Facebook.
Okay. And then I also, back to the jobs, I don't mean to keep jumping around, but you also have the LinkedIn page. Is that correct? Where you can check things out on LinkedIn as well?
Absolutely.
Okay. So is there anything else that you'd like us to know about the new Beaumont?
No, I really appreciate your time and giving me the opportunity to join your podcast, and I look forward to receiving some feedback from our patients.
Okay. Now we're going to wait a little bit, but we do have more things in store to work with you guys on this podcast. Sure. And one of the things is, Jasmine,
EFMP and what's going on with that, but that's not this time. That will be another segment for sure.
So if you want to just touch a little bit about EFMP to give people something to look forward to tune in next time when we have them. So.
Right. So a lot of changes coming to EFMP.
Yes.
We have what's called the web EFMP. So the virtual platform that's being rolled out.
Okay.
And so we're just now getting information on this new system, but we will definitely push that out.
Yes.
We'll then push it on Facebook, and then what we'd like to do is actually come back again for another podcast just to focus on EFMP so that we can inform and educate our beneficiaries here in El Paso and Fort Bliss.
Yes, and we're definitely going to make that happen. So folks, tune in for that.
Awesome.
All those EFMP questions, we're going to have them here for you, get them answered. Yeah. So Colonel Venable, thank you so much for taking time out of I know your schedule is busy. So thank you so much for coming and joining us today. And we greatly appreciate you. When we close out our podcast, we like to ask our guests what brings them joy about their job. So if you could tell us what brings you joy about being the commander over at Beaumont.
That is so easy.
I can see it in your eyes.
What brings me most joy is just the staff, wonderful staff we have at William Beaumont, and our patients, and just having the opportunity to go around and talk to the staff and talk to our patients. That's what it's really all about. At the end of the day, it's about the human relationships and the great friends and teammates that you build while you're in the office.
Yeah.
And so we have just an amazing team at William Beaumont. I couldn't be more proud to serve with the team over there.
Yeah, and I can tell because even with the mask on, your face lit up. It's like, okay, I can tell he's happy about that question. So again, thank you so much for joining us. And thank you all for tuning in and listening. This is Tracy
and Jasmine. Don't forget to subscribe and click that bell.
Bye.